circulates in our own body. And we said that there are two reasons for that, why the blood flows that way. Number one is because their right heart pressure is higher than their left heart pressure, which is opposite of what we have. And the reason for that is because there is no PaO2 inside their lungs. Okay, there's no oxygenated blood going inside their lungs, which then causes their pulmonary blood vessels to constrict. And then the other reason is because when blood is returning from their body, going to the placenta to pick up oxygen, the placenta is a big, huge organ with millions of vessels. So there's low resistance to blood flow into the placenta. So their left-sided pressure is low, it's very low, okay? All right, so now, here is the placenta here. Okay, remember, this placenta arises from the trophoblast. That is the organ of ventilation and oxygenation for the baby, not the baby's lungs and urine. So, blood leaving the placenta goes into the baby through what we call the umbilical vein. So this is the umbilical vein. It carries blood from the placenta into the baby. But the problem is that blood flow from the placenta into the baby encounters three shunts. Oh, let me swallow this before I aspirate. And then you have to intubate me and ventilate me. Okay, let me spit it out. I'm sorry. Yeah, I know. Leah's going to call it cold. Oh, how about this? Cassandra, please intubate. And then Kara is going to bag me. And then she's going to put me on pressure control because she doesn't like me.
Now put your volume control.
Pressure control, right? Not volume control. All right, so when this blood now is going to go into the baby through the umbilical cord, that's it. We'll call it the lifeline. The lifeline. That's what connects the baby to the mother. You know, the mother's blood is never in touch with the baby's blood in utero, unless there is some kind of trauma. Okay, like the mother is bleeding due to the placenta peeling off or some kind of blunt trauma, something like that. Otherwise, they never touch. Okay, but so what we're talking about here now, that blood flow is going to meet three different shunts going into the baby. Now, how do we define shunts? Does anybody remember how we define shunts? Now, shunt is perfusion without ventilation. You are getting perfused, but you are getting perfused with blood that is not adequately ventilated and oxygenated. So that means that it's going to have high CO2 and low PaO2. Okay? Now, the opposite of shunt is dead space. The dead space is ventilation without perfusion. So that's what, keep that in mind, that's what we're talking about here. Okay? So now, so here is the blood coming from the baby now. It gets to the placenta here. It picks up oxygen, and now it's going to go into the pulmonary vein. It begins to flow that way. And right here, about once it enters the abdominal cavity right here, about 50 or 60% of that blood now will flow to the liver. Now, the liver is a very vital organ. The liver does almost everything in the body, you know? So about 60% of that blood will go, or maybe 50% of that blood will go into the liver. what is left will continue down the line. So about right here, remember this blood now is adequately ventilated and oxygenated because it just came from the placenta, right here. So it's got enough oxygen and it's low in CO2 going that way. Some of it has already gone into the liver and then some of it is going down the line. So what happens then is that this is a vein here through which blood from the lower portion of the body is returning, okay? So now this blood coming from here is high in CO2 and low in oxygen. So it's deoxygenated blood. So it's coming from here. Now this one here is high in PaO2 and low in CO2. So this blood now will meet together. They mix together. See that? So once they mix together, that means the total ventilation and oxygenation of the blood now that was coming from the placenta will decrease. Does that make sense? Yeah. So this is the oxygenated blood coming from here. This is oxygenated blood. Now they mix somewhere here. Okay? So once they mix together, you dilute the concentration of the blood. Okay? That means that the PaO2 drops and CO2 will go up a little bit. Okay, so that's the very first shunt. Because now what we have now is, we have perfusion, but now we have reduced ventilation because the deoxygenated blood has mixed up with oxygenated blood that was intended to go into the baby's blood. So that's called shunt. Are you following me? How we got the shunt? Yeah. Any questions about that? So that's shunt. The very first shunt, baby shunt. And that is called the ductus venosus, right here, belly button. Okay, about right here. Okay. So ductus venosus is the very first shunt that the blood coming from the placenta that is going to go into the baby meets. There's a decrease in the ventilation of the blood that was intended to go into the baby. That's why we call it shunt. Yeah, we usually get rid of that once the baby is born, right? Once the baby exits the birth canal, we call the umbilical cord. Okay? And then we clamp it. And then you have some mothers that put alcohol on it, and then after a while, it falls off. Okay, that's how you close the ductus venosus after birth. Every one of these shunts has to close after birth. Okay? All right, so now, with that now, the blood is mixed up here now. There's decrease in the ventilation of the blood going into the baby. Okay? So it continues here, and then it goes into the baby's right atrium. Can you see that? And then you have some more blood, the oxygenated blood here coming here now, goes into the baby's right atrium. So if you want to, they don't call, this is, call it superior vena cava, but that's not what they call it in Europe, but that's what it is. And this is actually a continuation of the umbilical vein is your inferior vena cava. So that's the inferior vena cava, that is your superior vena cava. Okay? So the blood now dumps in here in the right atrium. Okay? So the second shunt now, because normally, remember now, that this blood now that is in the right atrium is supposed to go into the right ventricle now, like in hours. It's supposed to go there next, and then it's supposed to go into the pulmonary artery after that, and then it goes to the lungs. But inside the baby, once that blood is inside the right atrium, there is a little hole here between the right atrium and the left atrium in the arterial septum. There's a little hole there, right here. That is the second shunt. The reason that is the second shunt is because blood is supposed to go from here into the right ventricle, and then it goes to the pulmonary artery, and then it goes to the lungs. But now what's going to happen then, once the blood is in here in the right atrium, is because the baby's right heart pressure is higher than their left heart pressure, most of that blood in here now will shunt through this hole here. The pressure will push it through this hole here, and then it goes to the left side. Because in ours, blood coming to the left side has already gone to the lungs, right? Before it comes to the left side. But now you have this blood here, most of it, going through this hole here without going to the lungs, through the normal process, into the left side of your heart, like it's already been to the lungs. So that's shunt there, okay? So the foramen ovale, okay, is the shunt between the right atrium and the left atrium, a little hole through which blood is pushed into the left side. Any questions about that? That's the second shunt. Blood going to the left side without going to the lungs. Okay, on this one here, we got blood, deoxygenated blood that mixed up with oxygenated blood that was intended to go into the baby. All right, so the next thing then is that the blood, the rest of the blood that did not go through the foramen ovale now, will go ahead and go into the right ventricle. Okay, let me say that again. The rest of the blood that didn't get shunted to the foramen ovale, to the left atrium, now will go into the right ventricle. Okay? And then it will go into the pulmonary artery. Maybe it's pulmonary artery. Now, this is where the lungs are supposed to be. Here's the right lung, here's the left lung, right here. But now remember that blood cannot flow inside the baby's lungs because their lungs are very constricted owing to low PaO2. They don't have oxygen. Oxygen is a vasodilator. Okay? But babies don't have oxygen inside their lungs when they're in utero. Their blood vessels are constricted. Because of that high pressure in their pulmonary system, when the blood gets here, it cannot go inside their lungs because of the pressure inside the lungs. High resistance. So the only other choice that the blood has is to flow directly into the aorta. Now you see, again, we're bypassing the lungs. That blood coming from here is supposed to go to the lungs to get ventilated. But now we're bypassing it, so it goes directly into the aorta. So this point here where the blood coming from the pulmonary artery directly goes into the aorta is called the ductus arteriosus. Ductus arteriosus. That's the third shunt that the baby's blood meets. Okay? I'm going to go through it one more time because you got to understand this. It's a lot on the exam. So the ductus venosus is the very first shunt that the baby's blood encounters as it flows from the placenta into the baby. It is shunt because deoxygenated blood mixes up with oxygenated blood coming from the placenta, therefore decreasing, okay, the total ventilation status of the blood that was coming from the placenta. So perfusion without ventilation. And then the blood continues down the line, a continuation of the umbilical vein, and then it goes into the right atrium. Now, because the baby's right heart pressure is very high, owing to hypoxia inside their lungs, the majority of the blood will be pushed or shunted, will be pushed or shunted through the foraminal valley into the left atrium. That's the second shunt. The blood is again bypassing the lungs before it goes to the left side. Okay, so the amount of blood that didn't go through the foraminal valley will continue down here into the right ventricle and then goes to the pulmonary artery, but it cannot go into the lungs because of high resistance inside the lungs. Therefore, it flows directly into the aorta, descending portion of the aorta. So at that point, where it flows into the aorta is called the ductus venosus. We bypass the lungs or decrease the ventilation of the blood 3 times. That's why we call it the baby's shunt or fetal shunt. Any questions about that? So now, what you're going to see here then is that the blood that shunted through the foraminal valley, okay, finally will go in here, in the left ventricle, and then the other blood, and then goes through here, and then meets this other blood that is coming from here, okay? And then they branch off and perfuse the abdominal cavity, like the kidneys and the liver, things like that. But now, that blood is not 100% ventilated. That's the most important thing. In spite of what we say that the babies don't need a whole lot of oxygen. I mean, they don't, normal PaO2 for a baby is 50 to 70 millimeters of mercury. 50 to 70. Ours is 80 to 100. Babies don't need a whole lot of oxygen. Okay, so the thing goes all over their body, perfusing different organs, and then the organs will use up whatever oxygen is inside that blood, and then it comes back that way and displays into this is called let me see if I can spell it. It's called the iliac artery. Whether it's one L or 2 L's, iliac artery. So that artery brings the blood, deoxygenated blood, back to the placenta, right here. And then it picks up oxygen again, that blood picks up oxygen, and then it goes out through here. So to wrap up this, what I want you to get out of this is that the umbilical vein carries oxygenated blood from the placenta into the baby. The umbilical artery returns deoxygenated blood from the baby back to the placenta. So it's kind of like switched. In us, the artery takes away blood, okay? And then the vein returns the blood, okay? So that's how come when we define an artery, the way we define an artery is that any blood vessel that takes blood away from the heart except the umbilical artery. Okay, because the umbilical artery returns blood in the baby to the placenta. Okay, so, but generally, an artery is a blood that takes blood away from the heart. A vein is an artery, a blood vessel that returns blood to the heart. But you have those 2 exceptions. Okay. Now, pulmonary vein returns oxygenated blood to the left side of the heart. So that's another vein that carries oxygenated blood. Now, pulmonary artery takes blood to the lungs. That's another artery. That's an artery that carries deoxygenated blood. Okay? So you got to remember, when you're dealing with the baby, so when they say umbilical vein, well, you know that they're talking about the oxygenated blood. When they say umbilical artery, well, they're talking about the oxygenated blood. So don't get it mixed up with adult circulation. So here it is again. Like I said before, the three shunts have to close after birth. That is part of the transition that the baby has to make after the baby is born. Anytime the shunts don't close, we got a problem. The baby will have congenital abnormality or after birth abnormality. Like you have patent ductus arteriosus, it didn't close, so the baby got a problem. We're going to talk about those diseases down the line. Okay? So now let's go through this one more time now. Here is the ductus venosus. Okay? The point at which the umbilical cord meets umbilical vein, okay, which is actually inside the umbilical cord, meets deoxygenated blood coming from the lower portion of the body, right here. Okay? After birth, like I said, after birth, the umbilical cord is cut off, okay? And then because there's no more blood flow going through it, it will shrink and becomes a supporting ligament. And then eventually, as mothers put alcohol in it, it falls off. That's where that closes. It will shrink because there's no more blood flowing through it. The foramen ovale is right here between the right atrium and the left atrium. Blood is shunting through there because the pressure on the baby's right side is higher than their left side. After birth, that also has to close. So what happens then is, after birth, as the baby begins spontaneous breathing, because once you cut that umbilical cord, the baby wakes up, because there's no more oxygen coming to it. Okay? That causes the baby to immediately to start breathing. And then from breath to breath, their PaO2 increases inside their lungs. So when the oxygen increases, the pulmonary blood vessels will begin to relax and open up. Right? So if that happens then, when the PaO2 begins to increase from breath to breath, the pulmonary blood vessels will begin to relax. And the pressure now on the right side drops. And then it will drop lower than the pressure on the left side. So what's going to happen there is the foramen ovale is not well drawn, it's kind of like this. That's the way it kind of looks, actually. So, once the pressure here drops, that flap here is pushed by the pressure on the left side. Pushes on it, and then it snaps shut like that. There's a tissue flap on the left side of the foramen ovale that will snap shut once the pressure on the left side, increases more than the right side. And that is going to happen because of the PaO2, increasing PaO2 inside their lungs that causes the pressure in there to begin to drop. Any questions about that? Now, you probably have heard people having a hole in their heart, right? Yeah, that's what we talk about there. They have a hole in their heart. It did not close for some reason. Okay? Yeah, when we start talking about those conditions, we're going to talk about what they call here material septal defects. Material septal defects. That's when it didn't close up. It causes some problems. It causes a lot of shunts. So the last one, the ductus arteriosus, is this one here. What causes that one to close also is increase in the baby's PaO2. Increase in baby's PaO2. It's chemical inside the baby's body called the prostaglandin. Prostaglandins. There is a lot of prostaglandin being produced while the baby is in there. What the prostaglandin does, this is the ductus arteriosus. There's smooth muscles around it, the ductus arteriosus, that keeps it open. Those smooth muscles are able to keep it open while the baby is in there because of high level of prostaglandins. And what causes more prostaglandins to be produced all the time is hypoxia inside the baby's lungs. Hypoxia. Because the baby's lungs do not have adequate oxygen, there's more prostaglandin being made to sustain the smooth muscle around the ductus. Keeps it open. So once the baby is born now, the baby begins to breathe spontaneously, getting oxygen, more oxygen from breath to breath. Therefore, there is a decrease in the production of prostaglandins. And then, these smooth muscles now will begin to wear off. There's no longer anything protecting this. That shunt closes. That shunt closes. Any questions about that? So the baby has to make all of these transitions. And if they don't, then we'll get a problem with the baby. Okay? So one more time, the ductus arteriosus will close, ductus venosus will close because the umbilical cord is cut off immediately the baby exits the birth canal. There's no more blood flow through it, therefore it will spasm and shrink and becomes a supporting ligament, and then after a while it falls off. That's the belly button there. That's what it is, the belly button. The foramen valley, okay, will close now because all of a sudden the baby's right heart pressure will be lower now. Okay, once the baby is born and the PaO2 increases in it, the pulmonary blood vessels will relax, causing the pressure on the right side to decrease, lower than the left side, and then the left side pressure will push that flap closed. And then the ductus arteriosus will also close owing to PaO2. Okay? Any questions about that? So a baby gets more PaO2, there's decreased production of prostaglandin, which then causes the smooth muscles around the ductus to go away. And then it closes. Any questions about fetal circulation? The babies have what we call the baroreceptors. There's got to be something in there that tells us that the baby is under a lot of stress. A lot of stress. So the baroreceptors are responsible for that. Okay? The baroreceptors are located in the carotid arteries and the uric arch in the baby. What they do is to detect pressure changes. When you stimulate the baroreceptor, the baby usually will have bradycardia and hypotension. Bradycardia and hypotension. Now, I tell you now, our own bradycardia is different from the baby's bradycardia when the baby is in the womb. Okay? So we'll talk about that. Because our own bradycardia is when the heart rate is less than 60. Theirs is less than 100 inside the womb. Because we can count their heart rate. Yeah, we can use ultrasound and count the baby's heart rate. And I love the way that sounds, you know. The mother comes in and they will get that handheld ultrasound and then put some jelly on it and then finally they find it goes like, ooh, 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 right? Ooh, 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 ooh. I'm like, man, I can dance off of this. All right. We also have chemoreceptors. Chemoreceptors. Okay? The chemoreceptors are located in the carotid arteries. They regulate ventilation, and they are sensitive to changes in blood gas values. They let us know when the baby's pH is very, very low, when the baby's CO2 is very high, and when their PaO2 is very low. The chemoreceptors will sense that. And they play a role in the initiation of the first birth. They are geared into action. Because what happens is that once you cut that umbilical cord, you've cut the lifeline. You know, the baby is no longer able to get oxygen from the placenta. You cut it off. And then this guy says, oh, okay. Because quickly what happens is that the baby's PaO2 will drop once you cut it off. The baby's PaO2 will drop and their CO2 will begin to rise. And then the chemoreceptors will notice that right away and causes the baby to take that first breath. So they play a good role, a very important role, in the initiation of the first breath. Now, we talked about placenta a little bit. The placenta is the organ for respiration and ventilation for the baby, not the baby's lung in the womb. They arise from the trophoblast. The trophoblast is what finally forms the placenta. The placenta is called the afterbirth. Okay. Again, once the baby comes out, contractions, uterine contractions continues until the placenta is expelled. Okay? Now, one thing that they may do, a respiratory therapist may do sometimes, is to sample ABG from it. Once it comes out, you know, get some blood, you go run it. Okay, because we're trying to determine the viability of the placenta. Has it been providing enough oxygen for the baby? That gives you an idea of what the baby's oxygenation status will be and ventilation status when you do one from the placenta. Because if the placenta is rich in oxygen and low in PO2, it will reflect on blood gases. Doctors will ask you to do that sometimes. So they are responsible for gastric change. Okay, gastric change. Like I said before, the mother's blood is never directly in contact with the baby's blood, unless something went wrong. There's something called like placenta previa. We're going to talk about placenta previa is when the placenta is right there in the cervix, and it makes it very difficult for the baby to come out. That can cause bleeding. You can have premature rupturing of the placenta, okay, from the uterine wall. That can cause bleeding. The mother can fall and have trauma. That can cause bleeding of the mother. In those cases, the blood can mix. But other than that, they're never in contact. So what happens then is that the exchange of carbon dioxide and oxygenation between the mother and the baby is through diffusion, because these are gases, through diffusion, okay? So fetal blood arriving to the placenta, coming from the left side, okay, is low in nutrients, and that makes sense. That makes sense because the organs have already used it up. It's low in PaO2. The organs have already used up the oxygen returning from the baby. And then it's high in CO2. So they arrive there to the placenta. The placenta is the mother's blood. The mother's blood replenishes the placenta. The maternal blood is high in nutrients, high in PaO2, low in carbon dioxide, and low in waste material. So through the process of diffusion, okay, there is gas exchange. Diffusion is the movement of gas from area of high concentration to area of low concentration. For instance, the PaO2 in the mother is higher, but it's lower in the baby. Therefore, oxygen will diffuse from the mother into the baby. The PCO2 in the baby is higher than it is inside the mother. Therefore, carbon dioxide will diffuse into the mother's blood. And so it's owing to concentration gradients. Okay, that's what we talk about diffusion. Okay, that's one of the things that affects the rate of diffusion, concentration gradients. If you have more here and you have low there, then more will go to the low side. Now here is the umbilical cord here, the lifeline. It connects to the placenta at one end, and then on another end it connects to the baby. So it's a lifeline, okay? Now, if you cut open a cross-section of the umbilical cord, if you open it up, it has 3 blood vessels in there. 3 blood vessels in there. Well, actually, yeah, well, 3. Yeah, 2 of them are the same, but it's 3. So you have 2 umbilical arteries, the blue ones, 2 umbilical arteries. And again, the umbilical arteries return blood, the deoxygenated blood from the baby to the placenta. You gotta know that. And then it has 1 umbilical vein, the red one, which takes oxygenated blood from the baby, from the placenta into the baby. But there's something else in there called the Wharton's jelly. It's jelly-like material, okay? Now what the Wharton jelly does is to lubricate those 3 blood vessels and prevent them from hanging together or tangling up. So the Wharton jelly is a lubricant because if they tangle up, then we have problem. We have obstruction problem here. For instance, if the umbilical vein, somehow got twisted, okay, then that means that the baby will never get oxygenated blood supplied to it. And then if the arteries got pinched off or tangled up, well, there won't be enough blood coming from the baby to the placenta to pick up oxygen. So either way, you're dead, okay? So that's what the Wharton jelly does, lubricate the 3 blood vessels. The amnion is the sac, the womb. So usually when women get pregnant, the womb will begin to grow in size as the baby grows larger. Okay? But it gets to a point where it doesn't grow anymore. Okay? Towards the end of the last trimester, it doesn't expand as much. So what happens then is that if you have a baby there that is more than 42 weeks, or maybe they are bigger than their gestational age, they don't have enough space in there to swim around. So what happens is that the baby gets in distress. If that happens, the baby is going to poop. And then we'll turn around and aspirate the poop, which then clogs up their lungs. Once the baby is born, we better be there to do resuscitation, because they're going to have major problem with their breathing. Okay? So that's the amniotic sac, the amnion there. Now, the amniotic fluid is the fluid inside the amniotic, inside the sac. Okay? About 1 liter is present at the end of term. Fluid is constantly being produced, absorbed initially by the fetal skin and also swallowed by the fetus. So the fetus produces the fluid and then swallows it. They swallow it all the time, okay? And then they pee it out, okay? They pee it out, okay? So they swallow, they pee it out, they swallow, they pee it, because that fluid is constantly being produced. They have to have amniotic fluid, otherwise the baby cannot move freely in there. That's another thing that can put the baby in distress. They can't move around. The amniotic fluid allows them to swim around, like they've been to the beach or something like that. All right, so there is something called the polyhydramnios. Polyhydramnios. That is when a mother delivers the baby, but there is excessive fluid at birth. Excessive fluid at birth, because after all, the baby is supposed to be swallowing some of the fluid, but the baby didn't do that. So if you have too much fluid at birth, it can indicate some problems with the baby. Okay? It can be that the baby has a swallowing problem as a result of CNS malfunction. Hydrocephalus is big head. You have all the fluid in their head. Okay? Now, God bless a mother that is going to have a baby that has hydrocephalus. You may just end up having a C-section, because it may not be maybe too large to go through the birth canal. Or maybe another thing that can cause that is what they call the spina bifida. Spina bifida is when the spine fails to close at birth. Because the spine doesn't close, usually down here. It doesn't close up. You see it, it's visible. Okay? They have spina bifida. That would be a reason that the mother probably has polyhydramnios. It can be due to orogastric malformation. The baby is supposed to be swallowing some of the fluid and peeing it out too. Now, that will be due to what we call the esophageal atresia. Now, atresia means obstruction. That's what it means. Atresia is obstruction. I know I don't speak good English, but that's what it means. I can speak that one there. Atresia means obstruction. So esophageal atresia means something blocked their esophagus. Okay? So they can't swallow some of the fluid. If the baby has Down's syndrome, that can cause it too. Now, Down syndrome is when the baby is born, it's like genetic in origin. Baby is born with this distinct physical characteristics. They look different with diminished intellect. Okay? You know what I mean? Have you seen somebody that has Down syndrome? Yeah, they're not stupid, they're smart in a way, but they don't have 100% intelligence. And, their face looks different, their eyes and stuff. Okay, so they have distinct characteristics, physical characteristics. Okay, that can cause it. Congenital heart disease can cause it, prematurity, and infants of diabetic mothers. Okay, so these are the things that can cause excessive fluid, amniotic fluid at birth. Any questions about that? And then we have oligohydramnios. This is when there is not enough fluid at birth. Okay? Now, if your water breaks, we got to see how much of it runs out. If nothing is running out, then we're in trouble. Okay? If too much of it, then we're in trouble as well. Okay? So, decreased amount of fluid at birth, indicative of urinary problem in the fetus due to renal dysplasia, something their kidney didn't form well, underformation or malformation of the kidneys, it just didn't form well. Okay, so, and then that may result, if you don't have enough fluid at birth, it means you didn't have it while the baby was in there. That can be some problem for the baby. It can result in Porter's syndrome. Porter's syndrome means like their body parts sticking together. Babies have you ever heard about like a twin? They came together with their head fused together, or their arms attached to this, or their leg attached to that. Part of what causes that problem is decrease in the amount of the amniotic fluid when the baby was in there. So that's called the Porter's syndrome. It can result in hypoplasia of the lung, underdevelopment of the lung. Underdevelopment of the lungs, that's what that means. It can result in compression of the umbilical cord, leading to asphyxia. Now, if we have more amniotic fluid in there, well, it helps out too, so that those vessels will not pinch off or get tangled up. But if you don't have enough fluid in there, well, they can get hung up somewhere on each other. Okay? And if they get pinched off, especially the umbilical vein gets pinched off, then the baby will have asphyxia. Now, asphyxia is deprivation of oxygen to the baby. Deprivation of oxygen to the baby is asphyxia. Somehow you are preventing oxygen from reaching the baby. And finally, let's talk about functions of the amniotic fluid. Now, the mother is going to have enough. Now, there is a process called the there is amnio infusion. Amnio infusion is a procedure by which artificial amniotic fluid is put inside the womb. Like if we know that the mother doesn't have enough amniotic fluid, it affects the baby. The baby can be in distress. So doctors can actually use needle, inject some amniotic fluid in there so that the baby is able to move freely. So amniotic fluid is very important.
Is that like something that's synthetic that they do, or?
Yeah, yeah. All right, so the amniotic fluid then prevents traumatic injury to the fetus. That's how come it acts like a shock absorber. You know what a shock absorber is on a car, right? Like when you go through a bump, you know what a shock absorber is, right? Yeah. No, the amniotic fluid sounds like a shock absorber. A pregnant woman can now fall stomach down, but nothing happens to the baby. Okay? Somebody can punch them if they're fighting with their husband, and then boom, you hit on a pregnant woman, well, you gotta go to jail. Don't you ever do that. Don't hit on a pregnant woman. I will help lock you up. Not just the law, but I will come out and lock you up too. All right, so that's how come that amniotic fluid protects the baby from that. The next thing it does is that it establishes thermoregulation. It has to be warm in there. It has to be warm in there. The baby gets used to it and it feels good in there, that constant temperature. That's why they are really scared to have when they come out. Because all of a sudden it's cooler than what they have been used to, and then they will start crying. And then finally, it facilitates fetal movement. The baby is able to move around. If your baby is not moving around, my friend, it's not a good news. It's not good news. Babies have to move around at least 10 times a day, at least. You know, anytime the baby quits moving, we check it out because the baby is supposed to move around. Okay? Any questions on the introductory phase of this course? All right. Well, I am done for today. I will see you all for this